Greetings, everybody. Political Mastermind here. Um, Welcome to my second video. This is kind of a video I didn't want to have to do, but I feel compelled to really have to present this information to you guys. So here we are. I guess we're going to start on a side note. My background's gray now, so if you like that better than the red, let me know down in the comments. Let me know if you like the red or the gray better, or if you think I should try another color. Let me know. But now down to the actual thing we're actually here about, which is coronavirus. So I want to preface this video by saying that I really think you should watch this information all the way through to the end. I'm sharing this with you because I've probably got a lot of friends and family that are going to be watching this. These are my first videos, so people who I'm sharing it with are people that are close to me, and hopefully word of mouth is spreading from there. And I want this information to go out to people that I know and I care about. So if you have people you care about, you probably want to share this video with your friends, your family, anybody, really. Just if you're also concerned you want to share the information, feel free to give links to people. I'm worried that this channel, due to the nature of what I'm going to present on it, is not going to catch a lot of traction with the YouTube algorithm, and that these kind of videos are going to really need to be spread word of mouth, from one person to another. So if you think this information is important, please go ahead and spread it as needed. So I started looking into the coronavirus. Everybody's been kind of hearing about it, and I, like everybody else, was kind of laughing it off. But it's, I feel, much more dangerous, or potentially dangerous, and the information really is not being put out there. So being a computer / a math guy, I like to crunch the numbers, and I started, going through the back roads of the internet, checking things out, researching, looking at things, as I often do on a lot of topics. And I was really alarmed by some of the information I was finding, and it made me just dig more and more into the research and look into more and more what's going on. And it literally led me into starting to do my own analysis of the numbers and everything, and starting to crunch things down myself. So let's just start by looking at some of the current numbers of what's going on here. What are we looking at? So let me just bring this up for you. So like every video, I'm going to be putting all these links in here. This video is probably going to have a lot of links because there's a lot of information I'm going to be providing. It's probably going to be a little bit of a longer video too. So these are the numbers. This is one of the ways I'm monitoring it, worldmeters.info/coronavirus. You can see right now we're sitting at 69,270 cases, 1,669 deaths, 9,658 people recovered. Active cases, 57,943. Those means those people are unresolved. We don't know what's going to happen with those individuals. Of the closed cases, you can see there's 11,327. Let me make it a little bit bigger so you guys can see it. So 11,327, 85% of the people have recovered. That's really not good. Fifth death rate of 15%, 1,669. When I started seeing these kinds of numbers and crunching it and looking back in the history is where I really started getting concerned. And if you look at these graphs, they're all ramping up. You're seeing a little bit of a leveling out maybe right here. It's hard to say because it's just the last couple days, but it's still in an upward trajectory. It's not really flattened out, and the deaths are just going up and up and up. There's a breakdown on this site if you want to see it by any given number, any country you want. There's a breakdown of what it is for every single state in the United States. This website has a lot of information in it. I started, like I said, doing my own numbers, and so I'm cranking the numbers in here every day. Just to let you know, on this day here, I missed some of the numbers, so these are averaged from the day before and after. So these ones are not necessarily reflective of reality, and this 13% isn't necessarily reflective of reality. But I started looking, and we were looking at around 16, 17%, 14, 15%. That's really, really, really cause for a lot of trouble. I've graphed these all out here on my own graphs. I've had a linear prediction put out for 20 days in the future. I mean, we're looking at about 120. So the blue line is the infections, the orange line is the deaths. 120,000 people catching the disease within maybe another 20 days. Death toll passing 2,600 or more in the next 20 days. Why are these numbers concerning to me? I've got some other numbers I'm working on out here for some different things, but I really don't want to get into that yet. That's just some more stuff I'm working on, but I'm going to be following this on the daily, looking at the news stories on the daily and monitoring this very closely. So if you want more information about this as we go along and as this virus continues to move along, like and subscribe, because I'm going to be having more videos about this undoubtedly in the future. So that's just the basic numbers right there. Let's go back and look at this again. Let's go straight into the Spanish flu. Everybody's kind of heard of the Spanish flu. It was just over 100 years ago. And what kind of numbers were we looking at there? Spanish flu killed between 10 and 20%. And when you look at what we're getting on this with the numbers I'm looking at, 17%, 15%, like I said, I made that one up, 15%, that is right on par for what Spanish flu was doing. Spanish flu killed up to 350, or no, never mind, excuse me. 350 would be today's numbers of the Spanish flu would come around. If Spanish flu came back, it killed between 5 and 10% of the world's population, as can be seen here. It says right here, estimated. It's all estimated because it's like such a long time ago that this happened. 10 to 20%, and it killed possibly 50 million, maybe as high as 100 million. And that was 3 to 5% of the world population. If we escalated that up, that would be 350 million people, with 40 to 60 million in the United States alone, if we had comparable numbers to that. People were saying, oh, well, maybe it isn't that, but I'm just showing you what the numbers of cases. A lot of people are saying 1 or 2%, but they're looking at the number of deaths versus the number of total cases, right? But that's not really always a very good indicator, because of those current cases, we have the resolutions over here, 57, 11,000 or 20% of the ongoing cases are serious or critical. So that's telling me that, we're still sitting at least at probably 10 or 20%, maybe 15, maybe it is right in the middle there. What this is, that these people don't pull through. So we could consider that of the active cases, we may get the same number coming out dead. And so this is very dangerous, very serious. And I'm going to go ahead and show some additional information from a bunch of sources that I've had. This is Francis Boyle. Let's give it a little bit.
Geopolitics and Empire is joined by Dr. Francis Boyle, who is international law professor at the University of Illinois. We'll be discussing the Wuhan coronavirus and biological warfare He's served as counsel to numerous governments, such as Bosnia and Herzegovina and the Palestinian Authority. He's represented numerous national and international bodies in the areas of human rights, war crimes and genocide, nuclear policy, and biowarfare. He's written numerous books, one of my favorites being Destroying Libya and World Order, which I assigned as mandatory reading material for my own students when I taught at the Monterey Institute of Technology. But most important for this interview, he's written a book called Biowarfare and Terrorism and drafted the U.S. domestic implementing legislation for the Biological Weapons Convention, known as the Biological Weapons Anti-Terrorism Act of 1989, that was approved unanimously by both houses of the U.S. Congress and signed into law by President Bush. And thanks for joining us, Dr. Boyle.
So that's who that guy is. So I'm just going to go to a couple parts of the video that I kind of noted. First being here at about 5:32.
We're dealing with here is an offensive biological warfare weapon that leaked out of that Wuhan BSL-4. I'm not saying it was done deliberately, but there have been previous reports of problems with that lab and things leaking out of it. And I'm afraid that is what we are dealing with today.
So what he's saying right there is that we're dealing with a potential biological weapon here. I was hearing this in several sources, and I'm going to show you several of these sources. I've not personally confirmed it, but I'm working to confirm it. I'm working to actually get the whole DNA profile of this new coronavirus, and I'll talk a little bit more about that as this goes on. But I debated whether I wanted to kind of share that information, as I haven't currently confirmed it, but I've heard it from several sources. I'm not saying it's true, put it that way. But if I didn't put it in there, I thought that might be doing a little bit of a miscarriage of justice, not letting you understand the full impact and the full nature of what may be going on there. This may be a biological weapon. There's evidentiary trails of certain people saying that yes, this is biologically engineered. Maybe it was just an engineered virus in a lab. Maybe it is a bioweapon. So it's up in the air, but I wanted that information to get to you guys to know how potentially serious this is. So this is just one of the people saying this is potentially a bioweapon out there. I'm just going to go ahead and forward to some other parts of this video. I'm going to 1326.
Or, in my opinion, is the most likely source. Applying Occam's razor, the simplest explanation. I'm not ruling out, some type of sabotage, but right now I believe that is the source here.
And you mentioned
just to let you guys know, there's a laboratory where they do experimentation on these viruses. This is a level, I believe, a B4 facility, which he talks about in this video. You can watch. I would recommend watching this entire video, but I'm not going to play the entire video, obviously, because that's a 40-minute video by itself. But if you are interested in this, watch the video. But to give you the gist, there is a virus lab in Wuhan where this virus originated. It's only 30 minutes from where that market is where they said it happened. And they've had problems in the past with almost, near misses for accidental releasing of things. So this could have been some person at the lab. Maybe they didn't bleach their shoes the right way on the way out, and they got this on contamination on their clothing, or who knows. And then they went out, and that market's only 30 minutes away. Maybe they wanted to pick up some dinner, go grocery shopping afterwards. And that's where the virus could come from. So that's what he's saying, is that it's likely that it may have come from that location. The location is definitely real.
And applying Occam's razor, and we know that Wuhan BSL-4 was research developing, testing SARS as a biological warfare agent. So it could have been they gave it this DNA genetic engineering enhanced properties gain of function, which we do here in the West, in the United States, all the time. We have all sorts of research that is clearly biowarfare research that has been approved by the National Institutes of Health. It's a joke. They know full well they are approving offensive biological warfare research, and it gets funded by the United States government.
So basically, he's just talking more about the level of the lab out there. Let's forward out here to 21, 25.
That you know, they're too dangerous. If you want, there's a excellent documentary called Anthrax Wars.
I'm definitely gonna be putting that in my watch
by
list.
Nadler and Cohn, and I'm in there repeatedly. And at the end, I say, with respect to these labs, 3 and 4, this is a catastrophe waiting to happen. Well, I'm afraid the catastrophe has now happened. So there it is.
So I've been saying this with other people I know in side conversations across the years, because I know there are these places developing these super flus and things like that, and I think that is just very dangerous, even more dangerous perhaps than having these nuclear arms all over the place in these various countries. And he's saying exactly what I'm feeling in terms of these things. We can, if this ends up being some kind of biological weapon that's escaped, we need to hold our governments accountable and say we cannot let these biological tests continue on to where it can accidentally be released and then basically kill huge numbers of people across the population. It's absolutely terrible. I'm just going to go ahead and forward it up here to 28 minutes and 20 seconds.
They're all live because they know what's going on here, and so you're going to have to figure it out as best as you can. But in my opinion, as of this time, and I'm fully prepared to consider further evidence on this, it does seem to me that this was a DNA genetically engineered biological warfare agent leaking out of Wuhan that has gain of function properties, which can make it more lethal. I think they're probably doing something with SARS to make it more lethal and more infectious. And so for that reason, you have to take extreme precautions. And they're now finally admitted, well, yeah, anyone within 6 feet can be infected. Whereas with SARS,
they're talking about SARS, and we'll get more into SARS a little bit with another video that's coming on the pipe here. Going on to 3040 through 3137. He ends up warning against initial vaccines that may come out, and what I would do is I would just tell you, if you're really interested in this information, watch this entire video. The link will be down in the description, so go ahead and check it out. Play this last little clip, and then we're gonna go ahead and move on. So he talks about certain Ebola viruses that were created and how this Ebola viruses actually helped to create new outbreaks when these vaccines are initially created and they haven't had time to be tested and they're rushed out. They can sometimes have bad effects. So watch the whole video, find out more about it. I'm gonna play this little
14-day incubation period where people can still be infected. So someone could walk right through a medical inspection and pass it, get into your country, and then they come down with the coronavirus. So that's all public relations, in my opinion, by governments, and they know it. And they're just sending people out there with temperatures and things like that. It's not like SARS. This is more dangerous than SARS. As I said, I think that Wuhan lab, we know they had SARS in there that they were dealing with, and I think they enhanced it. And I'm afraid, that's what we're dealing with. But I'm keeping an open mind as to what other sources it might have, and I wasn't prepared to say anything until that Wuhan lab is right there, and it's dealing with coronavirus. So again, apply Occam's razor It seems to me that's the simplest explanation
All
here.
right. So what they're
I guess
talking about, and he goes on to talk about the vaccines and stuff. I guess I encourage you to watch that. But he's talking about the 14-day incubation period. This disease, if you don't know already, has asymptomatic carriers. So what does asymptomatic carrier mean? An asymptomatic carrier means that the person has no symptoms. They don't have a temperature. They're not coughing. They're not doing any of that. They're walking around just like everybody else. You have no idea who's got the disease, who does not have the disease. This is very dangerous. That's why people are able to get through the airports. They talk about the temperature guns. They're putting the temperature gun in their forehead, see if they have a fever. They don't have a fever, even though they're carrying the virus. It has a very long incubation period. So that is what makes this particular disease so dangerous, because you don't have any idea who has it, who can spread it to you, and once you got it, you have no idea that you have it, and you're spreading it to everybody else that you know, because you don't have any symptoms until the disease progresses along. But the whole time, you can be spreading that disease to everybody else. This is very, very, very dangerous. So that is Francis Boyle. You heard his credentials. We're now going to go and look at a video from Dr. Lyons Weiler. He claims to have looked through the entire DNA profile of this, and he is somebody who I'm trying to communicate to get a download of the entire DNA profile. And we'll just listen to what he says. It's not that long a video, but we're just going to go right into this.
And this weird element that doesn't belong there, I found that it actually did a vector technology that was from the 1998 was the first time it was published in the Proceedings of the National Academy of Science. This vector technology is a mechanism by which molecular biologists insert new genes into viruses and bacteria. This vector technology is called a P-shuttle SN vector. Now, it's really unusual to find a vector technology sequence in a virus that's circulating in humans. And so naturally, one thing that we can say, I think for certain, is this particular virus has a laboratory origin. So we can
So what you're saying is this technology is something scientists use to put in and insert things into the genetic coding of a virus to work with it. And what you're saying is that this is an actual product that scientists use that's now been found by you in what was said to be a wild virus. How would a technology end up into a wild strain virus? Is that put
That's exactly
clearly?
right.
Okay.
Exactly put clearly. And so it should not be in the wild animals anywhere. And in fact, if you then take that sequence and compare it to other proteins that it encodes, we find that it's actually a SARS protein that was put into a coronavirus for the purpose of making the vaccine work better. That's why this element, I believe, is in there. That's the science is showing us that element is in there to create a more reactogenic, a more immunogenic vaccine.
All right, so going to the end of that video, I have downloaded this patent. I found this patent, and I'm going to see if that claim holds up. What he was saying there at the end of the video is that this is another theory, that they were actually creating this, they're altering this to make a type of vaccine against SARS, perhaps, and the vaccine was actually given to someone, and like the Ebola virus vaccine I described earlier, actually shed the virus, because a lot of times these vaccines are using live virus. Supposed to be diluted, less potent virus, but anyway, ends up maybe this case a more deadly virus, and so when they go to test it, doesn't always go according to plan. So that's Dr. Lyons Weiler. I'm going to continue to see if I can contact him and verify some of these statements that he's saying, if he really has gone in there and found the shuttle to inject additional DNA into the coronavirus and to inject SARS, part of the SARS genes, into the corona, then I want to see if we can verify that or validify it. So keep in store for that. Hopefully they'll get back to me. I don't know. Maybe they will, maybe they won't. But I'm looking into it because I want to see that for myself, if that is actually in fact the case. So now what we're looking at here is Professor Neil Ferguson. He's actually a professor in Great Britain, and he's in charge of mapping the spread of this disease. So let's go ahead and go into it. I'm going to play the first 2 minutes, 45 seconds of this video.
Good afternoon. We are here today with Professor Neil Ferguson, Director of JIDO, talking about the current coronavirus outbreak. Welcome. Thank you for taking the time to speak with us. Would you be able to give us an update on the current estimates that you're working on with your team?
So the main things we're working on currently are trying to get a better handle on really how lethal this virus is, what threat it poses to the human population. It's a difficult thing to do in an epidemic because just simply looking at how many people have died so far versus how many cases there are tells you very little. It takes quite a long time often for somebody from being diagnosed as a case to actually whether we know they're going to live or survive the infection. And so we're trying to correct for those factors. In terms of looking at the overall scale of the epidemic, we're getting kind of firmer estimates. What we can say is the surveillance ongoing in China is probably picking up, if you think of all infections out there being a kind of pyramid, it picks up the top of the pyramid, the most severe infection. We think probably 10% or less of all infections in China are being detected at the current time. The next tier down is really what's being detected overseas.
The numbers that we're seeing, I'll just flip up my chart again. When I was typing in these numbers and watching these just go from thousands to 10,000s to the many of tens of thousands in a very short order, that was one of the alarming things I was picking up on. I mean, that number just keeps going up and up and up and up. And this may be only
there we think sensitivity is somewhat higher, but still we may be only detecting maybe a quarter of all infections at that level. Lots of people will be entering, the borders are porous, countries won't be detecting every case coming in.
Right. Would you be able to say anything about forward projections of where the current outbreak is going?
Well, in terms of where we think the current outbreak has got to in terms of scale, we estimate that maybe up to 50,000 new infections a day occurring in China.
There may be up to 50,000 infections occurring a day in China. And supposedly the number right now is 60,000.
Which is obviously much larger than the official case numbers. So it's going up all
a lot larger
the time. So the forward projections depend really on the effectiveness of control measures. We think the epidemic is roughly doubling in size about every 5 days at the current time. It's hard to
doubling in size every 5 days.
Evaluate how effective controls are, but there's limited evidence of it slowing in China. Under that scenario, the epidemic would really follow a natural course, probably peak in its epicenter, Wuhan, in around a month's time. Some uncertainty around that, and then maybe a month or two later in the whole of China. The rest of the world will see epidemics at various times after that, depending on how well connected they have been in the past few weeks, how many travellers have come to them who are infected from China itself.
Other parts of the world will be experiencing epidemics at various times, depending on how well connected they are. Alarming.
As to the overall effectiveness of control measures.
So, I'll cut that off right there. Just to let you know, we're watching a couple things with this guy, and these are from various dates. This video is from February 5th, and so you'll see there's some more uncertainty with the numbers. He's always uncertain with the numbers. It's very hard to get to the numbers and what that fatality percentage is. And I've been trying to spread this information on my own, just like going into comments on videos and stuff and telling people, I say, this could be very dangerous, 15%, 18%, on the par with Spanish flu's levels of death, which was between 10 and 20%. And people are like, 1.2, 1 or 2% is what I'm seeing. You're going to see this guy's ideas of numbers change over time as we get closer to today. But I'm going to go ahead and forward this video out to 6 minutes, 9 seconds.
No vaccine. We have limited options for interventions at the current time. We have no vaccine. The vaccines are rapidly being developed, but it will take months, if not years, to develop.
So there are no vaccines. It may take months or years to develop vaccines. And like we saw in the last video, and if you go back and watch that whole video, vaccines that are rushed into production need to be very alert and suspicious of those. I'm going to go ahead and go straight to 620 or 633 here.
Is how we managed to control, for instance, the SARS outbreak, a genetically quite similar virus to this new virus. Whether those measures will be...
This is again somebody else saying that this virus is very similar to SARS, and this guy is not saying that it was genetically engineered. He's just saying that it's similar to SARS. It seems to be what they're getting. Now, just to let you know, if you are interested, SARS only affected about 7,000 people and only killed about 600 to 700 people. So we've already have almost 10 times the amount of infected in the official numbers than SARS, and already more than double the fatalities of what SARS was. So this is not SARS. Much more dangerous than SARS, and its asymptomatic carriers make it a much better vector for disease transmission. Very dangerous. Now I'm going to go out to, I think I'm going to leave that video where it was, and now we're just going to go to the next video featuring the same guy. This one is 10 days later, so this is a more recent video from the same guy, Professor Neil Ferguson, who is in charge in Great Britain, one of the main guys who is mapping the transmission so that they can make better decisions as to how to combat this virus or what to do. I'm going to go straight to 2 minutes, 10 seconds. And he does say, just to be clear, if you watch this video, these numbers are not certain for these death numbers. It could be higher, could be lower. But I felt this, being closer to today, being the 15th, and now it's 16:02 a.m., kind of what I was seeing in my own research, what I was digging up.
A variety of data sources, official case reports, and then early case data from China. We estimate something of the order of 18% of cases in certainly the epicenter, Wuhan, may die. That's not to say 18% of everybody infected with the virus in Wuhan will die, we think.
So there it is. So what I was thinking when I was officially concerned and starting to be concerned about this, when I was doing my own numbers, 18%, yeah, he's giving me the same exact number that I was kind of pointing to when I first started looking at it. Now we're looking more about 15%, but yeah, he's bringing up the same concerns that I had and repeating very similar numbers to what I had. And this is one of the guys who is mapping this for Great Britain.
Separately, that perhaps only 5% of cases are actually being tested in that city. So we're seeing a kind of severe tip of the iceberg, and hence we get relatively high estimates of the proportion of those cases who might die.
So what he's saying there is that maybe we're only seeing the most severe cases that are ending up in the hospital and being there, even though with the numbers we do have mild cases being 80% of what they're looking at, but we may be missing very, very minor cases if those things exist, which we don't really know. And if that is the case, then maybe that 18% number is high because we're not seeing any of the people who have really low amounts of symptomatic or symptoms coming from the disease. So that's that. I don't know if I had another part. Yeah, there was one other part in this video I want to play that I think is relevant. I'm going to go straight to 609 here, 608 close. Wait a minute, I think I went a little bit too far. I want to go 6 minutes, sorry.
Pandemics, all the way up to 4%, which would be more comparable with the 1918 Spanish flu epidemic.
So those who are saying that me saying Spanish flu is outrageous and you're going over the top and there's no way it's going to happen, words from his very own mouth. We don't know what the death rate is, but it could be as high as the Spanish flu, straight from his mouth. very concerning. Like I said, Spanish flu, if a similar event happened today and killed we had similar infection numbers, similar numbers of deaths, we'd be looking at 350 million in the world, up to 40 to 60 million dead in the United States. Sure, maybe this rolls over and this is a minor thing, but it does not appear to be a minor thing. I don't want to be alarmist, but I think that people need to know what's going on. And people in the United States, I just watched a survey, 60% of the people are not even, 60 to 70% of people are not even looking at this. No concern whatsoever. And I think we need to be a little more proactive in our concern about this particular disease. I'm going to show two other quick little videos. Same guy. These are a little earlier videos, so you're going to hear some different numbers, but that video we just listened to was the most recent video.
Probably where Wuhan was at the beginning of December in terms of the sort of numbers of infections which have likely established themselves in the country.
Latest estimates suggest that 60% of the world's entire population could contract COVID-19.
60% could contract this disease of the entire world population. That's what they're saying there.
If it's not controlled. Do you think that the infection rate of 60% of the population, which has been suggested by some of your colleagues, is realistic for Britain?
Potentially, given we know a lot about how these sort of viruses spread, we have lots of data from past epidemics, from influenza, given how transmissible this virus appears to be, and the fact that at least all adults can be infected, we have much less data in children, then 60% is a reasonable figure for the epidemic size within the first 12 months or so. What we don't know at the moment is, of everybody infected, what proportion might die and what are the risk groups. Our best estimate at the moment is that maybe 1% of people who get infected might die.
And in a mortality rate of 1%, that's 400,000 people.
Potentially. I would emphasize that at the moment, putting numbers like 400,000 isn't necessarily helpful because we have so little information.
But it's not an absurd number.
It's not an absurd number. No.
Are we overreacting?
I would much prefer to be accused of overreacting than underreacting, let's put it that way. And this virus is the one which probably concerns me the most of everything I've worked on.
Like you said, I'm worried about underreacting instead of overreacting. That's what's compelling me to make this video, because I don't want to be underreacting. I want my friends and family to be aware of what's going on. One more video with the same guy, and then we're going to move on.
In this country is just because, again, our surveillance is focused on travellers. We think probably we're picking up maybe 1 in 3 cases coming into the country at the current time. These numbers are the tip of the iceberg, particularly in China, where they're only detecting probably 5% of cases the most severe. So I think it's misleading to look at the Chinese case numbers. Effectively, they're just looking at the epidemic in Hubei and Wuhan province. Outside that province, they're only reporting cases which have a link to Wuhan. Since they sealed the city 2 weeks ago, it's unsurprising they're going down. I think we're in the early phases of a global pandemic at the moment. Singapore is seeing local transmission. The fact we've only reported 8 cases in this country is just because, again, our surveillance is focused on travellers. We think probably we're picking up maybe 1 in 3 cases coming into the country at the current time. These numbers are the tip of the iceberg, particularly in China.
All right, so we heard right there, this is the beginning of a global pandemic. Those aren't my words, those are his. He's one of the experts. Singapore seeing person-to-person transmission. We've seen person-to-person transmission inside Illinois in the United States. Was the first case in the United States of person-to-person transmission within our country. I know somebody is coming from Singapore. It's going to be coming to the city I live in a very short amount of time. So right now we're not seeing the airports and things shut down like maybe they should be. But that's because people aren't taking this seriously yet. But maybe we need to take this very seriously. You may not have heard this, but as of, I believe it was Thursday this week, close to 200 residents in Georgia in the United States were quarantined this week. You may not have had this information, but it's true. Nearly 200 Georgia residents are quarantined in their homes after returning from recent trips to China, where a deadly new coronavirus has sickened more than 40,000 people. So is there stuff going on here in the United States? Yes. We have 15 confirmed cases. There was just a case in Texas, an additional case in California this week, bringing California's total to 8. And here we have 200 people being quarantined in Georgia. I'll probably make additional video later where if people are interested in what's going on here in the United States specifically, but there are some very concerning things going on here in the United States. I'm going to pause the video for 1 second and continue. Sorry, I paused the video there for a second. The reason I did that is I was all of a sudden concerned that maybe the audio wasn't being recorded for the videos that we're watching, and I just confirmed that yes, the audio is working for those videos. So I'm going to go ahead and continue on. So we looked at the numbers there in Georgia. Next thing I want to show you is this little snippet here, which is also
when you find out that all the crematoriums of Hubei are backed up and cannot take bodies, and the bodies are stacking up, waiting for the crematoria. You know the numbers are enormous, and we know that the official numbers coming out are not accurate. A lot more of Xi's future is resting on how he deals with this epidemic. You know, if the party screws this up, the economic and political repercussions are going to be enormous. And many would argue they already did. I mean, certainly that's the implication that all of Wen Liang's mourners have taken from his martyrdom.
Right.
That he was killed by the party, essentially. Its unwillingness to allow him to warn all of us about this epidemic, and the unwillingness of the party officials inside Wuhan to take seriously the warning that he and other doctors, at least 8 of them, were all either jailed or forced to sign these confessions of rumor mongering.
Just how big a threat is the current coronavirus outbreak? This through the eyes of a reporter who has worked in over 30 epidemic zones.
So that was a reporter, and she's saying that the crematoriums are going at capacity and that the numbers coming out of China are not what they say they are, which you've already heard maybe several other people in this video state that China's numbers, there is a lot of stuff going on in China. And so this last couple minutes here, I just want to take a look. If you do look around, there are a lot of alarming videos coming out of China. I'm just going to show a couple snippets just to bring the reality of what's going over there to an American audience or to other audiences around the world that are watching this and have not been paying attention to what's going on yet. Just to let you know, I'm watching this 24/7 Crisis News Live Twitter channel just to get ideas. I don't know if you can believe everything that's on there. I'm not saying that they're a good, reliable source, but it's just another thing to kind of be looking for stuff and then verifying it. Always make sure you're verifying what you're saying as much as possible. But I'm going to go ahead and show several of the tweets of what's going on in China. Like I said, there's a lot of videos of things going on over in China that are alarming, but I'm just going to go ahead and show a couple. So this right here is a guy who was not wearing a mask in China, and they're dragging him off into a police vehicle because he wasn't wearing his mask. They're taking it pretty serious. This is a bus full of medics being taken to coronavirus hotspots to help aid, not knowing if there's going to be a ride back for them. Medical professionals are being infected and dying over there. This, unfortunately, I don't like showing this, but I think it's a realization as to what's going on over there. They're using multiple body bags to put children into. This is a very alarming and shocking video, but I once again want to stress that we need to be paying attention to this, focusing on this, and understand how important it is. I hear people saying, it's only affecting the elderly. Not apparently. Pretty disturbing. Here they are spraying the entire city with disinfectant. They're taking this serious over there. I'm thinking, yeah, we should be taking this somewhat seriously. We shouldn't just be laughing this off. People are dying over there already in more than 1,000. It's going to be 2,000 for those numbers. If we look at those numbers, if we're looking at my chart, that doesn't show signs of stopping. It only shows signs of going up. We're talking about multiple thousands here in just a couple days, a day or two. We're going to be at multiple thousands. Mark my words. We're going to be over 2,000 dead. My predictions here showing within 20 days we're going to be over 2,600. I'm not going to go in that whole video, but I want to kind of close it with this video here of supposedly chilling footage of people shouting. All these people are quarantined in the city. It's been completely locked down. Just listen to the hollering and crying from all the buildings and the people in the city. Sounds like hell. Literally, like the first time I heard that, my heart was pounding after I heard it. Like I said, let's not try to get super alarmist here, but let's try to get serious and pay attention to this. I just been finding all this information, and I wanted to put it out there. This is supposed to be like a political channel with about political videos, but I think this is going to become a pretty political situation pretty quick. And you might not be hearing about it from, let's say, candidates that are running for president. But if this continues, if this doesn't roll over and calm down and continues to spread, you're going to be hearing your candidates talking about it. They're going to be talking about, you thought we were talking about closing our borders before? We're going to be really talking about closing the borders when there's people coming in with a very dangerous disease, or if it's already here and we can't stop it, containing this. So I think it's going to be something that we're going to hear about. I hope I'm wrong. I hope that this whole thing gets better and this is just a false alarm and this isn't really a big problem, because this really isn't a story I want to share with you guys. But if I didn't share this with the people that I care about, and something does happen, I would feel bad for a long time, if not forever. And so that's why I'm sharing this information today. That's why I'm making this long video, because I care and because I'm seeing something that's coming down the road. When I go to a local group, it's called Socrates Group, where we talk about all kinds of, you can talk about anything, political things, anything you want. Nothing's forbidden. You can say anything you want about anything. And you know, I made the prediction long before anybody else that President Trump was going to win the election, and he did. And they said, wow, it was really crazy how you made that prediction so early. I'm just feeling like this is something important, and I'm making an early prediction, and I hope my prediction's wrong, but I'm predicting this is going to be very serious. It really bothers me because I talk to people who are like, it's just a cold. Have you ever heard of anybody quarantining 200 people in Georgia because of a cold? I ain't heard of that. That's never happened in my life. This, I feel, is very serious. This isn't a cold. This isn't 1 or 2%. Hopefully, those numbers could be 1 or 2%. But they may be much higher. And what we're currently seeing is a possibility of very high numbers, as high as the Spanish flu. This could be a global catastrophe. That being what it is, like and subscribe for the video. Share it out to your friends. I'm going to be putting out other coronavirus videos for sure. Absolutely that's gonna happen. I'm gonna have to have a follow up to this, and I feel compelled at this point to keep working on those numbers to try to find that information. Is it really a man-made disease? I mean, there's a lot of people kind of pointing toward that direction. I'd like to see if we get that confirmed, if we could get that whole DNA profile and make those kinds of confirmations. So yes, I want to make follow-up videos to this. I'm going to also do political videos. Hopefully everyone is not as grim as this one. I don't really want this to be a grim channel. I want to keep this, light. I want to do some comedy stuff in here too. But this is a serious one, and I wanted to put this out there, and I wanted to put it out there quick. And it was one of the main reasons why I want to make this channel, because I want to be able to provide information where needed, when needed. I think that I can help fill a gap for certain information that's out there. So thanks for watching. I really appreciate it. Once again, Auf Wiedersehen. We'll be seeing you soon. Bye. Don't forget to click like and subscribe. Once again, there's the email, politicalmastermind79@gmail.com. Thanks.